Hello, everyone. I'm Dr. Tiffany Mullen. I am the CEO and co-founder of Vytal Health, and I'm also a physician, and functional integrative physician here as well. And I am so excited to talk to Dr. Alicia McCubbins, who is a naturopathic physician at Vytal Health and an extraordinary healer in so many areas, women's health and just everything that she brings to the table as a physician at Vytal Health and in other places in the country. We're so excited to have her as part of our group. And we're talking in February 2022, and we're going to be talking about heart health. February is National Heart Month. And generally, I kind of totally shun those National Heart Month, National this one, that, because it just seems a little cheesy and kind of hallmarky. But at the same time, there's so much to this topic that I don't think we've really talked a lot about at Vytal Health, at least, sort of outward facing. So I thought it would be really fun to talk through heart health from a naturopathic functional medicine perspective and how we as docs think through evaluating risk, evaluating heart health, treating it, thinking about all aspects of it. It's quite a bit different than I think what you get in the routine traditional medical world. In fact, I know it is. I've been there. So the inimitable Dr. Alicia McCubbins, nice to have you here.
Oh, always a pleasure. And yes, when you asked me to talk about heart health, there is definitely a personal motivation to dive in, but also I was telling you earlier, this is my sweet spot. I love talking about cardiovascular health, both physically, emotionally, and beyond, because obviously there's that rhythm there that keeps us going. And when we talk about rhythms, it extends into everything else about your health.
Right.
And so, yeah, I'm excited to talk about it. And also, yeah, like you said, February may be Heart Health Month, but clearly this is a good time of the year to talk about it being the darker month of the year. And it can be a pretty lonely time, not just in the year, but also in this climate.
Yeah, right. And we keep saying we're in the middle of the pandemic, but we've been saying that for years. And a lot of people are suffering emotionally because of that. And when we think about the emotions, obviously we think about them as being sort of in the brain and in the heart, my heart's hurting or heartbroken, also the gut, so there's this sort of widespread idea of how much the heart affects the person and how critically important it is, obviously, to one's health. So do you want to share your personal connection? I'd love to hear about it, if you're comfortable with that.
Yeah, of course. It actually started way back in high school, being active in sports, which, as any parent, when your kid has a heart issue in sports, that's terrifying. Hence why we do sports physicals for teenagers. Right. And so I started having some chest pain during a basketball practice, and later found out that I had a heart murmur that is usually very benign, but and it still was. It was just I was overworked that day. And later, as time went on, found out that I have a hypermobility syndrome, which is a full body when your body's a little too lax, a little too flexible. And so I think it's very interesting when we talk about heart, we get very caught up in how's your blood pressure? How's your cholesterol? Blah, blah, blah. You have to remember the heart is a muscle. And within that muscle are ligaments. And so my ligaments are a little too loosey-goosey. And so the ligaments of my heart muscle were a little too loosey-goosey and overstretched, overworked. It was no problem. It was just very informative at the time and probably a little scary for our family, but it was nothing. And so fast forward, now 20 years later, I'm really learning about hypermobility and, again, the importance of heart health. So it's interesting to tie that in. But again, the focus on heart health and remembering that it is a muscle is going to give you some understanding of how to support it.
Totally. Well, thank you for sharing that. That's amazing. I think there's a lot of people who have hypermobility tendencies, all the way from just tendencies, where they're flexible. I have a gymnast in my family, so I'm there must be some of that, right? And then all the way through actual diagnostic problems with connective tissue like Marfan's and Ehlers-Danlos syndrome, and, you know, those very severe genetic versions of that, but lots of on the spectrum, a lot of different stuff in between. And yeah, it is an important thing to understand about oneself, because as you and I both know, in the way that we practice, we're trying to get as far upstream from risk as we possibly can, as opposed to what happens in the traditional healthcare system, which is reactive. Let's wait until it's broken and then we do something about it. Yeah. We as functional and naturopathic integrative physicians tend to not want to wait until things are broken.
Right.
So yeah. And we also don't take a super simplified approach to this very big topic. And so I think one of the things I think we could kick off with then is let's talk about maybe how we think through evaluating somebody who may have risk for heart disease because either they have a strong family history, you know, mom and dad, brothers and sisters, et cetera, who have developed cardiovascular disease, or they themselves have some risk factors like, you know, high blood pressure, prediabetes, diabetes, et cetera. Like, how do we take that apart? Because I think a lot, to your point earlier, I think a lot of people get caught up on, oh, it's all about cholesterol and it's all about, you know, the traditional risk factors. Tell me a little bit about how you approach it. How do you dive deeper on that topic? What do you evaluate? How do you think through that stuff?
I think the most important factors are the social factors, right? The things of like getting to know our patients. And yes, that's something that's often a little glossed over when you only have 15 minutes with the patient. So luckily we don't practice that way. Mm-hmm. So yeah, we dive into lifestyle, like how active are you? Not necessarily, are you exercising at the gym 5 days a week? Mm-hmm. How active are you and how much exercise is your heart muscle getting? Of course, we talk tons about diet, right? And then the other obvious things like smoking, of course, but then diving into family history and talking about, oh, how interesting, there is heart disease in your family, but it seems to follow like the men in your family. That gives me a clue of certain labs to run, you know? So the more you get to know the person, the more you can think about what specific things to look into. So of course, yeah, like exercise, diet, and all those lifestyle factors are important, but then the objective workup can be quite extensive beyond just cholesterol.
Yeah, sense of what that looks like for you. Like, what do you test when you're really taking a deep dive into somebody's risk panel, either because your antenna's up on that, or because, you know, they're very interested in understanding that more.
Sure. The big thing is looking at their red and white blood cells, making sure that the right size and then the like right consistency, things like that, that can give us ideas about nutrients that aren't getting absorbed. For example, if you're low in iron, you're not getting enough oxygen circulating around your body. Of course, that's going to compromise your heart and other things. Mm-hmm. But then we look into your chemistry, your electrolytes have to be well balanced. Of course, your heart runs on electrolytes, being a muscle. Mm-hmm. So if those are off, that's a concern. And then, yes, kidney and liver function, even though it seems not necessarily heart related, they all rely on each other. Mm-hmm. But then, yes, I look at a basic cholesterol panel. If that's off, then I would recommend doing a more extensive panel, especially if there's family history, looking at things like apolipoprotein A or lipoprotein B, and then homocysteine, which are inflammatory markers. Another one is CRP. If we get really into it, we might start looking into the MTHFR gene, which is a whole nother can of worms, right? But that's looking at the genetics around the heart disease factor. Let's see. What about you? What else are you running?
Yeah, definitely. I think people don't realize that the link between MTHFR and cardiovascular disease is pretty significant. Oh, yeah. And to your point, the homocysteine marker, I think is probably more commonly used out there in the traditional medical world as a sort of measurement of MTHFR function, but really understanding how significantly impacted that methylation gene MTHFR is really helps us tailor make how much methylated folic acid people need to take, right, for that.
Right.
Even if their homocysteine levels aren't high, that definitely can lead to it. And I love the deeper dive into the other risks. You mentioned ApoA, ApoB. Those are protein carriers, lipid protein carriers. They're almost I think of them like superhighways to and from the blood vessels. And those are independent risk factors that if you're just doing a basic cholesterol panel, obviously you wouldn't know anything about. You could have pristine cholesterol, for example, and have an ApoA or ApoB1 gene that's off and karyoprotein that's off, and all of a sudden you've got like a whole other can of worms. And then the particle sizes, obviously you mentioned more of a deep, right? Like one of the things that's fascinating to me is like LDL, low density lipoprotein, which is the one that we always focus on as the bad cholesterol. I think we tend to overreact to that so much, and the levels of normal have shifted so much, like, depending on whether you have risk factors, it's like driving this LDL down like way low in certain cases. So much of it comes down to that LDL's behavior, right? Whether it's a large fluffy particle and it bounces off the vessel wall, or it's a small particle and it drives into the vessel wall. I mean, we can know these things, and then we can really decide, like, okay, what is the risk and how significantly do we need to look at this?
Right.
Is that something that you do in your practice as well?
Absolutely. Yeah. And I mean, it's important to know are you more of a plaque builder because you have smaller, harder red LDL. But the other thing that I think gets overlooked is people get so excited about the good cholesterol, HDL, being high. Higher is not better. And I say this all the time, and often docs are applauding, oh, good job, keep doing what you're doing, it's almost 100. I'm like, no. High cholesterol, regardless of the type, is not good. HDL may be protective, but I typically don't want to see it over 75. The higher it is, the more inflammatory it is.
We have like a lot of data on that, like what is the ideal HDL cholesterol? We have we have these ratios where we can look at total cholesterol to HDL, which we do in a traditional lipid panel. And we have some data on that and what's an ideal ratio, typically less than 4.5. But like, where does HDL become too high, and what are the implications of that? I think for me as a clinician, I don't really feel like I have a good understanding of that,
The closer I see it to 100, the more suspicious I am of either alcohol intake may be a little too high for that person, or autoimmune sometimes is suspicious. Hard to put our finger on it, but over 100 is generally not a good sign to me.
It's an unusual kind of pattern to see. You mentioned inflammation, and I think this is a topic that we cannot say enough about, right? We could be here for days talking about inflammation. And you mentioned measuring a CRP, C-reactive protein, and some people measure high sensitivity CRP, HS-CRP, which is also called a cardio-CRP by some labs. What is it that when you see somebody who has elevated inflammation, knowing that that is a major contributor to heart disease and so many other diseases in the body, how do you start to counsel your patients on reversing that inflammation?
And it's important to also remember that those numbers are not just cardio specific, even though they kind of look that way when you get your blood work back, right?
Agreed.
Sometimes I see that CRP go up just when someone's on birth control for too long. Or if they have a cold, like with COVID, we've seen even CRP levels skyrocket. So temporarily. So it's important to know it's not just heart, but yes, inflammation. Like you said, that's a big topic because it's not specific to any one system. But generally what I do is I take a step back and say, all right, we've got to like refocus on that social aspect, like what is diet, what is movement, and then how do we take away those potential triggers for inflammation? Are you eating something that you just don't tolerate? Are you breathing in something in your air that is irritating your lungs and then thus, causing some inflammation? I mean, there's a lot there, but I'll also, like, beyond dietary counseling and lifestyle counseling, I'll recommend some gentle supplements like fish oil, which is so broad spectrum anti-inflammatory, right?
Love it. Like, so what dose, talk a little bit about, because fish oil is really, obviously, I think a lot of people associate omega-3 fatty acids, which are the main component of fish oil, and heart health. Like people kind of join those two things together in their minds. When you tell people to take omega-3 fatty acids, and I often do as well for patients for inflammation and heart health, what kind of things do you recommend they choose in terms of how to get the right supplement? And because they're all different, right? You can go to the store and there's a shelf full of omega-3 fatty acids, and how do you pick one? I
know, I do get a little picky about this one. There are some supplements where I'm like, sure, you can get that over the counter, but not fish oil. I mean,
Yeah.
of course, it's an animal product, and the way that animal eats is the way that you're getting that medicine.
Correct.
For example, like with omega-3s, if you're eating meat that is fed corn, corn is naturally higher in omega-6s. So that's kiltering that omega-3, omega-6 balance. So then therefore that meat is more inflammatory.
Correct.
If it's grass-fed, it's more rich in omega-3s.
Totally.
Same thing goes with the fish oil. If these are farm-raised fish, or if they're from areas of like really poor waters, you're not going to have a good omega-3 content. And then it's going to come with some other not so desirable ingredients, whether it's mercury or what have you. But anyway, yeah, good fish oil, what you're looking for is getting the maximum amount of omegas, specifically EPA and DHA. They need to be labeled on the bottle. If they're not labeled how much is on the bottle, you already know it's a waste.
Yes, exactly.
Right?
Right. Don't
And
like
so
those proprietary blends. Just trust
No.
us. There's plenty
Yeah.
in there. It's like,
Nope. Yeah. So fish oil specifically has EPA and DHA labeled, as well as total omegas, but I ignore that.
Me
And I
too.
want to add up EPA and DHA to be at least 1,000 for a reasonable amount of gel caps a day or tablespoons, right? Like you don't need to be taking 6 a day for
Yeah, because they're
1,000
huge.
milligrams.
They
Yeah.
tend to be very big. You're right.
Yeah.
Yeah. More
Most good
concentrated.
ones. Right. Most good ones will be like 2 gel caps a day for about 1,000 milligrams. And that's, you know, we can sometimes recommend more than that, maybe 2,000 or 3,000 milligrams a day, but generally 2 a day is good.
Yeah, totally exactly the way I approach it. Like if it
Cool.
takes a handful of them, you're probably not going to stick with it. Right.
Yeah.
Because they
Yeah.
tend to be honking huge things.
Yeah.
And then people, I have a lot of people who take, who find, you know, they'll go to Walgreens or whatever pharmacy and they'll find one. And there, you know, it says whatever it says on the front, 1,000 milligrams, 3,000 milligrams. And then you flip it around and you realize that so little of it is DHA and EPA.
Right.
So exactly what you said in terms of paying attention to the quantity of those two things, flipping the label around and looking at the back is key, totally key for omega-3 fatty acids. Label reading is everything. And then, so what if somebody is vegan or kosher or, you know, some of those kind of considerations? How do you approach those kind of patients?
It's a little bit trickier.
Yeah.
But generally there are some companies that will make an algae-based fish oil.
Yeah.
And so algae is going to have a better content with the DHA.
Yep.
It's a little harder with like the borage oils and the flax oils. You can still get those omegas, but it's not direct EPA and DHA. It's giving you more precursors for anti-inflammatory health.
And not very many people convert well. From what I read, like only about 20% of people convert the alpha linoleic acid, the ALA that's in those oils, into active DHA and EPA. I mean, that's not very much. Like you could be. Well, the other thing about flax oil is it gets rancid super quick.
Yes.
You know, like you keep it in your refrigerator and otherwise it just goes bad in like in a second. So
totally. I know I recommend a lot of ground seeds and I'm like, don't buy the flax ground. It's already rancid or the oils are worthless by the time you get it.
Absolutely worthwhile to grind it and keep it in the refrigerator so that it's fresher. But that doesn't mean that obviously you can't eat those precursors and get some benefit from it. You know, your walnuts and your flax and things like that. And then you raised an interesting thing about, you know, the contamination factor for fish oil for omega-3 fatty acids if it's derived from fish, and we know that the water has a lot of mercury, and so that's always a thing as well. There are better products and worse products, obviously in that area. So I think this is where, if you really want to do this right, if you're a person who needs an anti-inflammatory and you're looking at omega-3s, like really working with somebody who's knowledgeable about how to pick one is really important. Even though it's a supplement and you can get it on your own, I think this is where, you know, it really makes a difference to work with a physician who's knowledgeable about it. And
letting the dogs out.
Did you say the dogs?
Yeah, sorry.
who let the dogs out? I kind of want to insert like a.
Oh man.
But you know, then people are like, well, can't I just eat fish instead of taking a supplement? And I think, yeah, I mean, sometimes if you're a decent fish eater, not just salmon, people tend to think of salmon, but also, you know, barramundi and even, you know, all kinds of different freshwater kind of, you know, off the coast of Alaska, if you can find it there, halibut, for example. Have you ever seen a halibut, by the way?
They're huge. People
They're
fish them
huge,
out
and they're
here in the
hideous.
Northwest all the time. I know.
They're the
You have to
weirdest
go
looking
far.
fish. They have both of their eyes on one side.
Yeah.
It's bizarre.
Delicious.
Yeah, delicious, but not good to look at. And then I love seafoodwatch.org. Do you use that website for
All the time?
Yeah,
Yep.
great website for looking at fish and whether it's overfished, and at risk or contaminated, et cetera. They do a really good job of keeping tabs on like what are the fish that are safe and the fishing practices are good and that kind of stuff. It's a great resource for that.
Yeah.
What are some of the other? Go ahead.
That food as medicine is like so important to mention, right? Like, of course, eat your fish, but I also want to point out that when we're talking therapeutic levels of anything, food as medicine is great and it's always important and should be the basis of your healthcare. But when we're trying to like influence a more anti-inflammatory approach, getting that super potentized approach with the supplements is helpful. It's kind of like saying turmeric. Of course, turmeric is awesome as a spice for anti-inflammatory approaches, but getting it extracted, that curcumin out of the spice and then potentized into a capsule is going to put you way ahead. So
hard to eat that much curry, right? I mean, I love curry.
Love it. But
yeah, it's hard to get that much turmeric and curcumin in you with just eating it. Oh yeah, these are the really opportune things to do in terms of like getting enough in you and making sure that it's a potent enough level that you're actually getting something out of it. So turmeric, again, another really great turmeric, curcumin being one of the compounds of many that are in turmeric that are anti-inflammatory, great anti-inflammatory. And then you mentioned, the connection to food and food being triggering for inflammation, sort of the gut component of this, right? And like how if you're sensitive to dairy or you're sensitive to gluten, even if you're not celiac, those triggers are sort of stoking the fires and inflammation in the gut and creating kind of a systemic or whole body inflammation, right? So like how do you help patients with that? What is your approach?
Yeah. I love that you segued into this piece because my thesis in med school was gut or heart, right? Yeah. And like we think about heartburn. Well, the heart isn't affected by heartburn, but why are we calling it heartburn? Because that vagus nerve that runs through your heart and into your gut can be obviously they're right on top of each other. Yes. And so if your gut is disrupted, whether it's not having enough stomach acid to break down your food and then therefore causing heartburn, or if, like you said, you're having this like inflammatory response to something you're actually eating, your heart can feel that, but also it's just from generalized inflammation. So I often will have patients, including my mom, who I can talk about. I have the ability to do so openly.
Did she sign worried about
it? She did. She's like, you could talk about it whenever you want. But it's a really important reminder that she's always like, oh, my heart, I have this chest pain. I'm like, what did you eat today? And sure enough, she's like, I just had one glass of wine with, my Mexican dinner. I'm like, So we know you can't have corn and we know you can't have wine because you personally over respond to that. And whether it's the food that is the actual problem or the fact that she's not breaking it down well enough, and then therefore having this digestive response, and also she'll notice that, oh, my hands are a little tingly now, or like she'll have like more systemic responses to the foods that she's not digesting well.
Yeah. I mean, it's so personalized, right? I mean, this is everyone's so different. You can't universally basically recommend much of anything in this category.
Right.
You really need to know what's happening at the individual level, and if they are symptomatic in their gut, if they're having anything that would suggest gut inflammation or food sensitivities or other pathology in the gut, bacterial infections, yeast infections, et cetera. Really trying to unpack that and get at that, regardless of whether it's obvious or not, right?
Again, why we spend so much time with our patients.
I know, because it's just not that simple. It's not like, okay, well, let's check a lipid panel. We check a lipid panel on every single patient. We do the exact same thing every single time. And then we universally throw statins at people if their cholesterol is high,
Right.
So let's talk about that. Let's talk like, okay, so, I'm not opposed to statins. Statins are not a problem. They're not evil. They are absolutely the best thing for some people.
Yeah.
But a lot of people are afraid to take them, and they've developed a sort of a reputation of being one of those drugs that are, really bad for you. They definitely, in my practice, and I'm sure as well as yours, have a role in certain individuals who are very high risk. But there are some other things that we can use that may, in the right person, have a similar effect. So what are some of the things that you use when somebody's like, oh, it's sad, that's awful, scary, I don't know about that?
Oh, totally. I know. Well, I do sound like a bit of a broken record when it comes to this, but fish oil,
Yeah,
it's mandatory for cholesterol.
yes.
Remembering that cholesterol is made in the liver and broken down in the liver, and then like converted into hormones in the liver. So there is a role for cholesterol. Too low of cholesterol is an issue too, especially when we're talking about fertility and all that.
Yes.
Anyway, the approaches would be A, fish oil, B, liver support, and that can again look like diet and lifestyle, maybe some hydrotherapy, use of hot and cold, or top body treatments. But then herbs work wonderfully for the liver.
Yeah.
I have family that has some liver disease, and their hepatologists don't even realize the gravity of how well these herbs work. And so I always feel bad. I'm like, they have very few tools to support function.
Yes, right. Yes, treat diseases for sure. Hepatitis B, hepatitis C, and to a certain extent, I mean, really end stage cirrhosis. But really nothing like supportive of like early upstream liver problems. Right? So what kind of things do you use for that?
So some herbs that get the liver going would be things like milk thistle is just the most common. Turmeric is great. Again, anti-inflammatory and great for your liver. Any of the herbs that are like yellowish, if you think, oh, how interesting, liver, jaundice, bile, yellow.
Oh, interesting.
So Oregon grapefruit is another good one for the liver.
Okay.
So I will usually give complexes of herbs for liver support. And then another thing that might be helpful for cholesterol is plant sterols. Yeah. Plant sterile meaning cholesterol. So it's interesting to,
right?
So, the plant sterols can sometimes be helpful. Again, there isn't one perfect approach to any cholesterol picture, but, my least favorite thing, and I probably shouldn't say that it doesn't work, but I haven't seen it work, is the red rice yeast.
Really? Because I actually have seen it work.
Really?
Yeah,
I have not. I wish I did.
Yeah, I actually have seen it work, but it's not, it's a statin, so red yeast rice is a very low dose statin, very weak statin. It was Mevacor when we used to have Mevacor on the market. And I think, so basically Mevacor it was probably one of the first statins was extracted from red yeast rice, made into Mevacor, which is like, I don't know how old that is, probably 50 plus years. And they just concentrate it, right? So the way that we get statins now is just super, super concentrated in drugs, right? It's just a very concentrated dose. Exactly. Red yeast rice is a very weak statin, and so for some people, even if they're statin intolerant, they don't feel good if they can take a little bit of that. And I have seen some people improve their cholesterol panels on it. I mean, in my practice,
all right. I might not be dosing it high enough either.
Yeah, that's the thing. I mean, some people, I usually start people on like 600 milligrams, which is kind of the lowest dose, and then sometimes you do need to go up to 1200, 2400. It just really depends on the person, and I usually go really slow because, again, people tend to tolerate it better if we start off at a very small dose and increase it as needed, checking the cholesterol panel and seeing the responses.
And you're checking what, every 3 months or so too?
Yeah, 3 to 6, depending on the person. Yeah.
I mean, if we're like starting a new therapy and they're feeling really
right. Just to see, again, we want to move things forward. We don't want to just, sit around and sort of watch the pot boil. But and the other thing, we know that there's a lot of variation in how people process statins, at the genetic level, so these CYPs, the enzymes that help us detoxify, there's genetic variation in that. And so we can test that too, to see if somebody is, if we gave them a statin, even if it was a natural statin like red yeast rice extract, whether they would be at risk for developing the pain, the muscle pain, the myopathy.
Oh, right. Which, your favorite way to address that?
I love CoQ10.
Yes.
Yeah, it's like my favorite thing, because we do know that statins deplete CoQ10.
Yep.
It's pretty well known. And so even if you don't have symptoms of muscle pain, there is absolutely no reason why you shouldn't backfill the CoQ10, because it's obviously a really important supplement part of the body to make energy throughout.
Absolutely.
Everywhere. Yeah.
I've been prescribing it for gingivitis too, which, people think of that just as a dental issue, but I'm like, that's your cardiovascular system, and it responds really well.
Yeah, there is a definite risk between inflammation at the level of the gums and the development of heart disease. Very well understood. So yeah, not managing your dental health can have an impact on development of heart disease as well. So yeah, love that CoQ10. So let's talk a little bit, kind of as we wind things down here, let's talk a little bit about the more sort of social emotional aspects of the heart. We tend to think about heartbreak and heartache, and there's some really good studies that came out looking at loneliness and the impact of loneliness on longevity directly related to the development of heart disease. What are your thoughts on that, and how do you work through some of that with your patients and kind of get into some of that stuff with them?
Well, like you're probably seeing the last couple of years where we're talking much, much more about this. And I think people are getting a little bit more comfortable even opening up about it. Yeah. But yeah, it is very much related to that connection of the nervous system and the heart. And, I know we kind of like rushed through some of the labs, but some of the things that I look at too are like, how is anxiety and depression? What other things do we screen for that? And thyroid is one of those things. There's a lot of overlap with heart health and thyroid, and then the nervous system. But you'll also find that a lot of like the herbs and things that we use for the nervous system, for anxiety, depression, and for the heart, there's a lot of overlap there too. Totally. And some of the herbs that I use would not come as very surprising for heart health. The first one is anything in the rose family. We give each other roses as a sign of love.
Interesting.
Therapeutically, the rose family is very rich in vitamin C, which as a muscle, the heart responds very well to, as does the immune system, of course. But anything that is in the rose family typically is red, which I made.
Ooh, what is that?
This tea has some rose hips that I picked.
Oh, wow.
And we dried those.
Amazing. Look at you.
This is how we implement our actual like practicing medicine around here, right? Like I want to walk the walk. And then hawthorn trees. I'm not sure if they grow in the Midwest.
I don't know either, but hawthorn is really great for hearts.
Yeah.
Really
so
great.
I don't know if you can see, but these are like little berries that grow on the tree. And so hawthorn berries, hawthorn is a tree, but it's in the rose family. It has thorns on it too.
Oh, wow.
Yeah, that is the most widely known heart health herb. And hawthorn is thought to support both a physical heart, but as well as the emotional heart. And this is dating back to like, even natives were using it that way for a broken heart. Yeah. The herbs in that family are very, very sweet and they taste good, but it's also like calming and nourishing in a lot of ways. So yeah, generally I recommend a combination of rose and hawthorn, whether it's in a tincture or a tea or even supplements to support both a broken heart or an actual like heart condition.
Yeah, congestive heart failure, a sort of poor pump heart, right? That's either had damage for whatever reason, lots of different ways to have congestive heart failure, but that tends, hawthorn is pretty well studied there. Hawthorn and CoQ10 do a really good job of helping with congestive heart failure and keeping the pump of the heart, muscle of the heart stronger. That's amazing. One of the things I love about you is that you literally go out and you find these things and you have them, like you have them in your house. It's so, I always learn so much from you. You're like, oh, I just happen to have some of them. Like, oh my God. Like she has.
Well, being in the Northwest is an advantage, right? We only have winter for like 3 months of the year.
Yeah,
so we can get out more.
Yes, right, for sure. There's no hunting and gathering of any kind going on here right now.
Right.
That's amazing. But yeah, you mentioned the nervous system, and I think it's really interesting to think about the concept of the autonomic nervous system, the nervous system that's behind the scenes, keeping our heart pumping, keeping our lungs breathing, keeping our digestive system, all this, background nervous system stuff that we have going on, and the balance of the sympathetic and the parasympathetic, the two arms of the autonomic nervous system, and then the balance translating into something called heart rate variability or HRV, right? Don't you love heart rate variability?
Oh yeah.
It's a really well studied part of looking at how well balanced is your sympathetic and parasympathetic nervous system, because that definitely plays into the entirety of nervous system health, but certainly around heart. So the space between beats is that heart rate variability can be measured in a lot of apps and wearables, like Fitbit, I think measures HRV. My smart sleep number bed measures it.
Oh my gosh.
Yeah, I know. Isn't that crazy? And so there's a sense of like being able to objectively look at heart rate variability as a test for how well your sympathetic and parasympathetic nervous system are. The sympathetic is the fight or flight kind, and the parasympathetic is the digest and rest. And so you definitely want to have some balance between the two so that both respond really well. I love heart rate variability. It's obviously impacted with meditation, mindfulness, just deep belly breathing, yoga, anything that's getting at that piece.
And then the cross crawl movements like walking, running, swimming, crawling, those are helping process emotions through the amygdala, which is your limbic brain, your feeling of emotion. But of course, the brain is the nervous system, headquarters. And so that when they say go for a walk, it's much more than just get your mind off it.
Yeah, exactly. It's at doing that and physically making those connections and relieving the stress of that.
The other favorite point about that in that vagus nerve, sympathetic nerve, is both a heart, nervous system, and gut support is doing a little bit of digestive bitters. And that can usually be in a tincture, but you can even like eat something bitter. I know in Wisconsin, everyone's got, cocktail bitters in their cabinet, but those are made of gentian. Gentian is the most popular digestive tonic bitter herb. And having that little bit of taste on your tongue before you eat is attempting to tell your brain out of fight or flight into rest and digest, turn on the digestive system, and also calm down.
Really, really interesting. I love that you went to that, because I would never, as much as I'm like, oh yeah, that makes total sense. You want to be in a good state of mind when you're eating. You don't want to be eating on the run or eating when you're stressed or eating in a hurry, because that just sets you up for this sort of, maldigestion and not feeling well.
Sure. And inflammation and then heartburn.
Exactly. And while none of us are perfect, I have been known to be working and eating at the same time.
Oh, I don't know that.
Really. But I think, just remembering that it is better for our health to actually have that. One of the things that fascinates me, having lived in Europe for a year, was that the community piece, how the people in the Mediterranean part of the world, and this is true of other cultures too, but that's where I lived, do such a better job of having community as part of the way that they eat. So they actually stop, everything. They come together, they sit down and they have a meal, they laugh, they support one another, they talk. So when you look at the Mediterranean diet, which has always been associated with great heart health, part of that, I think there's a Mediterranean diet pyramid, and at the very bottom is community.
Oh my gosh, I love
that.
Eating
together and gathering and enjoying being together around good, healthy, nutritious food and sharing that together. And as I'm saying that, I'm like, well, maybe that's part of why we all sort of the impact of the pandemic has been so hard on us, for all the reasons that everyone knows about, but maybe that lack of community around eating has been a big part of it too, right?
Yeah. Oh yeah. And I love that you brought it in, like the Mediterranean diet too, because the perspective of the food is very cultural, right? Our diets have changed dramatically over the last 50, 100 years, obviously. But the Mediterranean diet has stayed pretty constant. And that is focused on that whole foods, like very few processed foods, whole grains, and like fish, of course, but with the focus on being good plants.
Yes. And variety, and eating it with love and eating it with pleasure. That's amazing. The studies on the Mediterranean diet and heart disease are astounding.
Oh yeah.
When they looked at people who had, heart disease, but no angina, so no pain from it, and they cathed these folks and they put people on statins and did, angioplasty, opened up the vessels, put stents in, and then they looked at people who just adopted a Mediterranean diet. several years later, the Mediterranean diet was so astoundingly much better in terms of outcomes. I mean, like,
food is
blew it
medicine.
away, it wasn't even a
Mhm.
question. It's like stent or fork. It's like, I think I'll take the fork, like
Yeah.
that will work for me, right? So, I mean, these are powerful interventions. People tend to poo-poo like, oh, it's not science, it's not delivered in the hospital. How could it possibly make
Or it
such a
seems
huge...
too common sense.
Yeah.
Oh, that's just too easy.
Oh, it's so
like, well, no.
Like, no, actually, if you look at, places on the earth where people live the longest, it's not because they have heart hospitals, it's because they have really great diets and really great camaraderie, and connection with one another, not just in other parts of the world, but here in the United States, there are certain communities that have proven that to be the case,
Sure. Yeah.
Yeah. So anyway, fascinating topic.
Oh my gosh, I could talk to you for hours.
My heart
so
feels
fun.
better just having talked to you.
Oh, I should send you some of this tea too.
I love it, actually. I don't think I've ever had rose tea before. That sounds amazing.
And the rose hips themselves are so sweet. You only need a little bit. So yeah. Oh, and then hibiscus is another one.
Oh yeah, hibiscus. I love hibiscus tea. Yeah, that's a nice red pigment too, isn't it? Yeah, delicious. We can't really grow it here. We can kind of grow it inside.
My dad does.
Oh really? Does it?
In Wisconsin. Well, what he does is he keeps it inside in the winter and then takes it out in the summer, and so he's so proud of it in his garden.
Okay.
But
that seems to work. Yeah, I tried to grow it in Phoenix. When I lived in Phoenix, I tried to grow hibiscus, and then I forget to water stuff. That's a problem.
Yeah. He's got a great thumb.
Anyway, so moving in and out of the house, I think that I just probably didn't get right.
There you go.
I'm going to try it again. I'm inspired. Because it's
pretty
hard to look at too.
Oh yeah, it's really exotic.
Well, thank you for all your amazing input. I always love talking with you because the way that you think through things and approach things from your training and your perspective is so interesting to me. And I always learn so much. So I really appreciate
Oh, likewise.
Yeah, I really appreciate all of the wisdom that you brought to this conversation. And I'm sure people will eat it up, hopefully with fish.
Well, I hope everyone finds a way to love something this month, whether it's, a new hobby, a passion, a new person, or themselves.
I love it. Yes, I was just going to say oneself, like some good self-acceptance right now.
Yeah.
Would be a really great dose of medicine. We all need that. Right. Thanks, Alicia.
You bet.